Rebecca, something there's a lot of confusion about is what is HPV and how dangerous is it?
So HPV stands for human papillomavirus. It's actually a huge family of viruses. There's over 100 different viruses. Many of them don't cause any symptoms at all. Some are linked to genital warts and can also cause some cancers. Usually our body's immune system fights off the virus. For a small proportion of people that doesn't happen, and that's when it causes changes to cells that can lead to some cancers. We know that HPV passes between people through really close skin contact, often during sexual intercourse, and that's reflected in where some of these cancers present. So the cervix, penis, anus, vulva, and even some throat and mouth cancers. And one of the issues is that HPV can lie dormant in our body for years. And if it doesn't present with any symptoms, then people may not necessarily know that they have it. And that's why particularly cervical screening is so important.
So cervical screening is really important, as is the HPV vaccine. So how does the vaccine work to protect people?
The vaccine's been an amazing scientific development, and what it aims to do is to reduce the chance of HPV infection happening in the first place. It doesn't completely eliminate it, there's still a small risk, but it really does reduce it. And you know, because of the way in which HPV is spread, the aim of the vaccine is to be given to boys and girls aged between 12 and 13, so year 8 at school, before they become sexually active.
Okay.
It's also offered to some other higher risk populations, like men who have sex with men under a certain age. And it can be given in adults, but it's certainly much more effective if it's given before you contract HPV.
And how would you advise parents around conversations that they might be having with their children about HPV and about the vaccine?
It's really difficult, isn't it, to know when to kind of broach those topics anyway. I think that there's potentially an advantage in the vaccine being rolled out, often in a school setting, in that kind of 12 to 13 year age group. It might be a good opportunity to kind of broach the subject of safe sex. I think the other thing that it's really important for parents to be aware of is, you know, children are often talking about this at school anyway. And it's probably better that that information comes from you rather than from, you know, less reputable online sources.
Okay. So basically what we're saying then is HPV is a really common virus which most of us will have at some point. Usually it causes no issues, but it can go on to lead to changes in cells which can become cancerous, especially with a focus on cervical cancer. So the best things we can do to protect ourselves is, for children, have the HPV vaccine when it's offered, and later in life to attend all cervical screenings.
Absolutely.